Hepatitis B is a major problem in Africa, yet it is not being accorded the attention it deserves. In Kenya alone, about 10% of the general population are infected by hepatitis B virus, and if appropriate measures are not taken urgently to address the problem, then more and more infections are bound to occur. It is for this reason that Dwele Foundation mission is to advance awareness in chronic hepatitis B. A recent workshop on hepatitis B organized by Dwele Foundation at Moi University Medical Center in Kenya was premised on the foundation's core objective of promoting health awareness in communities and in the underserved populations. The main focus and vision of Dwele Foundation is to advance awareness in hepatitis B in Africa and among Africans. To grace the occasion was a liver specialist, Dr. Bob Perillo, from Dallas, Texas.
We are privileged to have Dr. Perillo to give us this presentation. Dr. Perillo is a thought leader when it comes to hepatitis B, not just in America, but globally.
Dealing with the important issue of hepatitis B, a serious condition of the liver. It's caused by a virus, and it leads to chronic infection of the liver, and it can take lives.
Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic diseases. The virus, which is transmitted through contact with the blood or other body fluids of an infected person, is 50 to 100 times more infectious than HIV.
This is a serious, potentially serious condition of the liver, which actually causes very little, if any, in the way of symptoms. So people don't feel sick. Yet they carry this infection with them, can give it to other people unknowingly through body fluid contact with their body fluids, through intimate exchanges and other sources.
According to the World Health Organization, WHO, an estimated 2 billion people have been infected by the hepatitis B virus. Hepatitis B virus is the most serious type of viral hepatitis. About 600,000 people die every year due to acute and chronic consequences of hepatitis B. Although hepatitis B is a potentially life-threatening liver infection, it is preventable with the currently available safe and effective vaccine.
This can all be prevented by vaccination, particularly if you're a newborn and born of a carrier mother of hepatitis B. You should be vaccinated to prevent picking up the infection. If you acquire this later in life and haven't been vaccinated, you can be treated.
In essence, one of the major elements of the workshop was to highlight challenges medical practitioners face in diagnosing hepatitis B.
It's very frequent that doctors do not appreciate this, do not recognize it. Patients certainly wouldn't. There's no symptoms, and it needs further attention through screening, and screening is something that we hope to achieve on a broader base in the future.
There is no specific treatment for acute hepatitis B. Care is aimed at maintaining comfort and adequate nutritional balance. Some people with chronic hepatitis B can be treated with drugs including interferon or antiviral agents. However, in developing countries, most people with liver cancer die within months of diagnosis due to high costs of medication.
The worst thing you can do for a patient with Hep B, particularly when they're inactive carriers, and you don't recognize it, is to give them immune suppressive treatment. Let's say they have cancer, and you want to give them cancer chemotherapy, and you don't screen for Hep B, mistake, because you can cause reactivation of the viral infection and the same process again.
Dwele Foundation's vision statement is to significantly and positively impact healthcare policies in respect to neglected but deadly communicable diseases in developing countries through enhanced advocacy.
The possible path to sustainable hepatitis B management in a country of low resources is going to be based upon a multi-pronged approach. You have poor data and public awareness already as an issue, so the health ministry has to be behind raising this as a public health issue.
There needs to be a public education campaign. There needs to be signage. There needs to be, brochures and advertisements, perhaps even in movie theaters, whatever works to get people aware of hepatitis B.
Since chronic hepatitis B is a silent killer, it is the contention of Dwele Foundation that in the current environment, adequate attention is not directed to this catastrophic ailment.
My personal interest in coming here was to see if we could lay out the groundwork for a management program for hepatitis B that would involve screening as well as treatment. This is something we hope to be able to achieve so that we can help Kenyans with this serious health problem.
The core value of Dwele Foundation always remains to promote awareness about hepatitis B in Africa and among Africans. It is in this context that the director of Moi University Medical Center warmly welcomed this initiative by Dwele Foundation.
I want to thank Bob and Clement for coming and giving us this enlightening presentation. I know it is an area we don't talk about much. We always talk about HIV. If it is not HIV, it is TB and malaria and pneumonia, because those are the common things we see. And it is not that it is not a problem. It is just because its effect is felt much later. So that when you see somebody with the cancer, and the relationship is very, very remote, so that even the policymakers don't appreciate it.